CEO of the Neighbourhood Pharmacy Association of Canada, Justin Bates.
Pleasure
Welcome.
to be here.
Nice to see you. Thanks for joining. We have an exciting program for you tonight that is going to be really interactive and is for your benefit. Just a couple of housekeeping items before we dive into it. This is a live webinar, and we encourage our viewers to call into the show. You should see a number at the bottom of your screen, but in case you don't, it's 1-877-584-6420. We're going to try to take as many calls as we can, and for those who weren't able to join us tonight, this will be archived as well so they can watch it later. Now, I'll give you a little bit of background about what we're doing and why we're doing it. Justin and Allan are joining forces this evening to talk about a new era of healthcare that is sure to be ushered in by the new Ontario government and what this might mean for the pharmacy profession, our patients who are seeking care, where and when they need it, and in resolving some of the challenges that the healthcare system currently faces. Now, last week was an exciting and hot time. On Friday, June 29th, Doug Ford and his executive council or cabinet were sworn in by the Lieutenant Governor. Christine Elliott, no stranger to healthcare, who's the MPP for Newmarket Aurora, was sworn in as not only the Minister of Health and Long-Term Care, but also as Deputy Premier. We have a new Deputy Minister of Health, Helen Angus, who comes over to Health from having served as Deputy as Treasury Board. Helen replaces Dr. Bob Bell as the Deputy at Health and Long-Term Care. And she should tell you too, Helen was also an Associate Deputy Minister at the Ministry of Health before. She's certainly no stranger to the Ministry of Health and Long-Term Care. So lots of new people at the top, including a new parliamentary assistant to the minister, Robin Martin, who is the MPP for the riding of Eglinton Lawrence in Toronto. She's a parliamentary assistant, as is Effie Triantafilopoulos, who's from Halton Region, but Effie will focus in on the long-term care part of the Ministry of Health and Long-Term Care. An important change as well is that the provision of mental health services for children and youth is now shifted to within the ministry, so it's an exciting time. Lots of changes. We had a new government. It's time to press the reset button and turn the page and look forward. So I'd like to ask you, first and foremost, your perspective, your opinions on the new government. And Allan, maybe I could start with you.
Sure. Thanks, first of all, for the update in the background. Let me first begin my comments with congratulations to our colleague, our pharmacy colleague, and my very good friend Jeff Urich, who was recently appointed as the Minister of Natural Resources and Forestry. We will certainly miss Jeff in his frontline role in health, but certainly in chatting with him after the announcement on June 29th, Jeff has assured me that he will continue to be a strong advocate for the profession in the legislature. So we're very, very optimistic about that. We're very, very excited and energized about and hopeful about the new government. We believe that after 15 years of a Liberal government, it's time to turn the page. And I think this new Ontario government, it offers, as I said, some hope and an opportunity for pharmacy to re-engage, reignite, and reestablish our position in the healthcare system. Our members, our listeners tonight, Joe, you know, and Justin, we know that pharmacists have the skills, the knowledge, and the ability to help end a lot of the challenges that we're facing in healthcare, most notably hallway medicine. And we look at things such as minor and common ailments, looking to tackle those head on to decrease some of the strains in our system. Our pharmacists are at the front lines of healthcare, and we have the pulse of the community. And so we believe that we can certainly bring some very refreshing ideas to government. We're very eager to begin working with them and speaking on, if I can, on behalf of OPA and neighborhood pharmacies. We believe we're aligned with government in what we are hearing now as the quadruple aim in healthcare, and that's improving health outcomes, lowering health system costs, improving the patient experience, and probably most importantly now, from our perspective, improving the provider experience. We believe that pharmacists can be one of the magic bullets to our challenges and to this equation. We're looking forward, as I said, to working with government and implementing some real change.
Okay, well, that's great. Thank you for that. And certainly OPA is no stranger to the new minister, Christine Elliott. I certainly met with her a number of times when she was the health critic in the PC caucus. So that's great. Thank you for that. Justin, let's hear your perspective on the new government.
Sure, and I think starting off, I'd echo a lot of what Allan has said. Anytime there's a new government, there's an opportunity to position pharmacy and pharmacists as a solution. I think we have an opportunity to develop and establish a trusted relationship with government and continue to demonstrate the value that pharmacy brings in neighborhoods across the province. We have over 4,000 points of care that can be better leveraged, and certainly tapping into and maximizing the expertise of the pharmacists in the community to create capacity in the system. And really, we're all patients, both directly and indirectly, and we're taxpayers. So we understand the need to work with government to deliver efficiencies, but we think that pharmacy is well positioned to deliver on both the efficiency side and really make it about patients. We have solutions that are ready to deliver on enhanced patient care, equitable access to medicines, and ultimately to drive towards a better healthcare system and a more sustainable healthcare system in the province.
So we have 4,000 readily accessible points of healthcare throughout Ontario that people can go and get their healthcare needs met, which is great. So again, we will be taking calls. For anyone that wants to call and wants to queue up, it's 1-877-584-6420. Now, Justin, I'm going to start with you on this next question. What priorities do you expect the new government will want to consider from the perspective of pharmacy?
Mm-hmm. I think they're going to want to look at how do they work with pharmacy to deliver on their policy objectives around better care, high accessibility of that care in the community, particularly around the ability of pharmacy and pharmacists to deliver high quality, cost-effective care. And that's really the premise of our cohesive platform that we launched in partnership with the Ontario Pharmacists Association, looking at the areas that we can have patient-focused services that drive better value in the healthcare system. So we had a 4-point strategy starting with how do we better leverage minor ailments, common ailments in the community to drive better utilization of resources. And it's really about enhancing interprofessional collaboration. It's not about an us or them mentality. It's really about getting the right person in front of the physician, the right person at the hospital, and those patients that can be served in the community can access through a highly accessible healthcare provider. One of the things that we know in recent polls is that pharmacists still rank amongst the most trusted healthcare professions, more than any other healthcare provider at 94%, and that was a nationwide poll. So the question we have is how do we better leverage that trust and the relationship to better help people manage their conditions in the community and keep them out of emergency rooms and for minor ailments out of physician appointments. We still have certainly an issue with respect to people having access to physicians. So having the highly trained and skilled pharmacists accessible to communities is really going to be an important part in driving efficiencies in the healthcare system. And if you look at the other parts of our system, I think it's well aligned with the data that shows the savings and the benefit to patients when you expand on the success of the flu vaccination that's been in pharmacies for several years in Ontario. We certainly would like to see that expanded to all publicly funded and available vaccinations, building on that success and harnessing certainly the skill set of the pharmacists. And the other two parts of our platform that I think we're certainly going to be advancing will be enabling point of care testing for things like strep, among other conditions. We'll be able to get timely access to results, which will certainly have better health outcomes and faster treatment plans. And then lastly, certainly germane to a lot of our joint advocacy efforts throughout Ontario and Canada is on the medicinal cannabis file. We think that it's important to continue to advocate for the role of pharmacy in the dispensing and distribution of medicinal cannabis. Again, looking at it from a patient perspective, how do we ensure that patients are part of that circle of care, whereas today they fall outside of that circle through the current LP mail order ACMPR system federally. And we think we have a government that will certainly want to work with the private sector and with the associations to drive towards better healthcare for Ontarians.
And I think it's reasonable to expect with the legalization of marijuana and cannabis, that there will be patients who are experiencing it for the first time. So as a non-pharmacist, it makes a lot of sense to me that the patient should have the benefit of speaking to a healthcare provider. Certainly I won't be speaking to my mailman when he brings the cannabis in the mail. So that just, there's an elegant logic to what you're talking about, and I think it makes a lot of sense, and I trust that the new government will agree and see the logic in that. Okay, so again, our number is 1-877-584-6420. When you dial that number, you will be speaking to an operator. It won't be one of us, so don't be discouraged if we're still talking as you're still dialing. I'm going to switch over to Allan now. Allan, are there concerns that you have of the government as it relates to healthcare?
I think, Joe, with any government, you wonder what their strategies are going to be, and I think we're in that stage right now. It's very early on. And it still remains uncertain as to what the formal positions are going to be, and how, probably more importantly, how our profession is going to be impacted. But government has been very clear in terms of its mandate that it's going to be looking for efficiencies without trying to compromise service or jobs. And so from that alone, we're still very helpful, want to be helpful. We believe and we're aligned with that mandate. We've been concerned for many years that, just working with the past government, that policies have often been implemented, conceived, drafted, that impact the profession, but that don't actually involve us in their construction, in their implementation. And one of the things that we're looking for is an opportunity to be at the table. For policies, programs, initiatives, even regulations and legislation, if it's going to be impacting the profession, or if it's going to be impacting patients where we are going to have a role, we want to be at the table. We want to help. We want to collaborate. We want to be there to help with the construction, so that. And again, in line with that quadruple aim, we want to improve the patient experience, but we also want to make sure that it doesn't compromise the provider experience. So these are part of the concerns that we have. We believe that this government is going to be open to that type of dialogue, but time will tell. And nonetheless, we are hopeful. Again, I reiterate, we are at the front line. We are helping patients manage their health care every day, and we know the intricacies of the challenges they face each and every day, and we hear the questions. Our members can attest to the sheer volume of questions that they get. Things like, how do I manage multiple medications, whether it's for my heart or for my cholesterol? How do I, what vaccines am I going to need if I'm going to be traveling? What over-the-counter products can I take if I'm using medicinal cannabis, to use that topic? And also, how do I, more importantly with the opioid crisis, how do I avoid getting addicted to my pain medications? These are questions that pharmacists deal with on a daily basis, and that's just skimming the surface. So because we're providing these answers to patients every single day, we believe we have a message that we can bring to government, and that our messages and our perspectives have value. And we believe that this will help with construction of policy and help strengthen our health system.
Well, certainly I would say that both organizations have done really well with the previous government of establishing the fact that you're not only advocacy organizations, but also repositories of considerable knowledge, health policy expertise. And I think an early challenge will be to ensure that the new government, the people in the Ford government, come to recognize quickly that you advocate, but you also know a lot about healthcare and pharmacy and the provision of community-based care. All right, so thanks for that, Allan. We're going to open up our lines now to see if we have any calls, anyone who's been watching that wants to ask our two guests a question. Please go ahead.
We actually have a question that was submitted through email.
Okay.
It reads, recreational cannabis is scheduled for availability to Canadians in October. When will we know if the government is going to allow pharmacists to dispense medicinal cannabis?
Let me take a stab at this, Justin.
Sure.
You can jump right in. I think the ink is actually still wet on Bill C-45 and its passage through the federal government. It still remains to be seen what the provincial governments are going to want to do in the area of medicinal cannabis and whether or not pharmacies are going to have a role in that. Like Joe said like you said in your introductory comments, it makes absolutely solid common sense for pharmacists to play a role in this. I've had the pleasure of speaking to a number of business groups on the matter of medicinal cannabis and how that's going to be distributed in the province. And everyone seems to be nodding their heads in agreement that pharmacy needs to play a role, and quite simply from a matter of patient care. Integrating medicinal cannabis, treating it like a prescription, that is how it is being positioned, then let's treat it like a prescription. Let's put it onto a patient's medication profile so it can be captured in the reviews, and it can help us to inform providers of an appropriate medication management.
Yeah, absolutely. I agree with all of those comments. I would also add that when we think of the potential public health, public safety risk of patients that are going to potentially self-medicate, we know that there are many different strains of medicinal cannabis, and having the clinical safeguards and the clinical oversight of a pharmacist within that circle of care with access to all the information when it relates to drug-to-drug interactions, contraindications is really critical. We're a low-risk option, and we're the logical, commonsensical option. We've been advocating for a number of years, and there's still a lot of education that's required, especially at the federal government, around the difference between medicinal and recreational. And certainly there is a push to, in Bill C-45, you see a lot of language around pharmacists, and we're trying to figure out what that means and where the gaps are. But I think the momentum is clearly on the side of healthcare providers being involved and helping to mitigate any of the potential challenges that will be related to medicinal. And I think it's important that we educate not only policymakers but patients as well.
Sure.
Because of the difference in the strains and the complexity of being on multiple medications, having it through a place where we know that 94% of the population trust their pharmacist. And in our polling that we've done collectively and individually, it shows the public opinion support for pharmacies' role in the dispensing and distribution of medicinal cannabis is extremely high. So, you know, with where it's going, and the colleges are starting to, in each of the provinces, and even here in Ontario, the Ontario College released an update on their position with medicinal cannabis. We're trending in the right direction, but I think we need to continue to demonstrate why pharmacies need to be involved, educate on the clinical aspects, and position this as a win for government.
Great. And again, thank you. Our number, if you wish to get on the phone and ask a question, is 1-877-584-6420. And just before we get to the next question, James, I actually wanted to ask Allan and Justin, so that the new government was sworn in on Friday, and on Saturday we saw an announcement come up that they were making changes, and not insignificant changes, to the OHIP Plus program. The OHIP Plus program was the pharmacare program for people up to age 25, where the government essentially paid for prescription drugs, most of them anyways. So in your view, what will those recently announced changes mean for pharmacy?
Let me again start, and Justin, you can certainly add your colored commentary. I think I speak for both associations to say that certainly from a conceptual level, we're certainly very receptive and supportive of changes to OHIP Plus. Looking back to the implementation, lead up to implementation, and the launch of OHIP Plus in January of this year, we had forewarned the government at the time of some logistical challenges, particularly in the area of exceptional access program, limited use products. We knew there were going to be some complexities and some challenges, and quite frankly, some very significant delays in providing medications, the needed medications, to patients. We're hopeful that the government of the day now will listen to the perspectives of pharmacy. Unfortunately, with the original OHIP Plus, we were brought into the equation very last minute. The program had pretty much been constructed and was not appropriately informed by the pharmacy industry. profession. That said, I think we now have a lot of lessons learned from OHIP Plus over the past 7 months. And I believe the government is going to be receptive to the pharmacy message, so that we're not replacing the original program with a program with new problems. I believe that the government is going to it's going to be a very positive change. We believe this will provide a little bit more equity, a little bit more assurance for pharmacists. There will be some challenges. I will acknowledge there will be some work because yet again we're going to be asked to jump through hoops and navigate the coordination of benefits of claims. I think those can be expected, but we're used to those.
Anything to add, Justin?
Well, I think regardless of government, when you look across the country at the political and public discourse around national pharmacare, there's a lot of different definitions of what that means. And at the end of the day, one of the, I think, benefits of having that debate about coverage is that when you look at all the stakeholders involved in Ontario and on a pan-Canadian basis, we all agree on a set of principles. And I think it applies to OHIP Plus in particular, in that we want to have an enhanced and certainly equitable access to medicines across the province. And so we want to work with the government to ensure that it's fiscally responsible and sustainable, but also that it's implemented smoothly and within a time frame that Allan mentioned can work through some of the potential challenges both on the communication side and technically. But ultimately, whether we think about this from an Ontario perspective and also nationally, we need to make sure that we have solutions that are positive about patients and that really do address the gaps of care across the country. And I think that's where the resources should be certainly geared towards.
Okay, great. Thank you. James, do we have a caller on the line?
Yes, coming up, we have a question from Dean regarding OHIP Plus. Dean, you're now live in the line. Can you please go ahead?
Hi, guys.
Hey, Dean.
Welcome.
Hey, my question, you guys, I think, just answered my question pretty much, but I guess maybe I'll change it slightly because you did answer most of it. But Joe, your opinion, I mean, we've had this government less than 2 weeks, and, typically pharmacy goes to government almost begging and pleading to hear our cries, whereas, we've seen this government actually proactively come out and I probably identify something that fundamentally we knew was wrong right from the start. And, the Wynne government, looking at, probably the wrong people to save some money on healthcare costs and that sort of thing. So I guess, Joe, and almost anybody could answer it, is really like, when you see something like that comes out so quickly as an announcement, I mean, that was probably the most surprising thing that, all of a sudden, Christine came out and said, you know what, we need to change this program. It's wrong. So, like I said, you guys answered most of the question, but I just sort of like your opinions on that.
Well, I can start if you like. I mean, I think that pharmacists and pharmacies should be encouraged by the fact that the PC party in its election platform, when you get to the health section of the Progressive Conservative Party platform, put in writing that they will be seeking the input of frontline healthcare workers when addressing the healthcare issues in Ontario today. As you've both articulated, no one is more frontline than your community neighborhood pharmacist. So I think that's encouraging. It became clear then with the timing of it that the universal OHIP Plus coverage model was not one that the Ford government was likely to continue to support. But I think as well, given that it was June 30th and there was some agreement or understanding with the insurance, the benefits carriers, I mean, you both can speak to this better than I can, that something changed on July 1st, so it was actually necessary to come out on that day. Am I right about that?
Well, there was a bridge that was provided by the private insurers on exceptional access program, and I do think that that plays a role. But that said, there's not a clarity around what's the timelines, what kind of transition are we looking at. So I think there's some still detail that we need to understand. Is the government going to be a second payer, as an example? So there's still some, certainly discussions that need to happen with the ministry. We have a commitment that there will be a consultation and that we'll have input into both the transition back and more detail, but I think they're certainly getting out in front of it because it is an issue, and there was certainly a cohort of the population that was having some challenges accessing medicines that they were covered for or had coverage for before and no longer had that coverage. So I think it's important to get it right, to take the time and to go through the consultation. There's undoubtedly going to be some challenges, but we need to work as a collective to get it right.
If I can just add to that, I think it's the hope that we have for this government. I think it can be seen with, I guess, with this announcement from Minister Elliott. It demonstrates that there is a receptivity to some of the challenges, Justin, that you had addressed. We know, as those frontline providers, that are right at that point where patients are being impacted. The delays that we saw with limited use, the delays that we saw with claims that had to go through exceptional access programs, which just, quite frankly, made no sense. It was very much, like Dean, like you said, it was a system and an approach that we knew was flawed right from the get-go. So there's this hope that the government is receptive to what they've heard, perhaps from their discussions with patient groups. And we're very hopeful now that we have a little bit of, not a whole lot of time. It sounds like they want to move on this matter, and so we're very eager to engage the ministry in these discussions.
Good. Thanks for your question, Dean. James, do we have another caller on the line?
Yes, we actually have another question that was submitted through email. It reads, what is the new Ontario government's position on national pharmacare?
Oh, early days for
Well,
that.
I think, yeah, I mean, Joe, you mentioned it right off the start. It's certainly early days. There's no clear policy direction on national pharmacare. I think we could potentially use the example of the recent announcement on OHIP Plus as a philosophical direction with respect to maintaining equitable access to medicines, which I think we all would agree is a principle that we're trying to achieve. The challenge with national pharmacare is that there's so many different definitions, as I referenced earlier, and there's different options to get to the same solution. And I think as Canadians and certainly Ontarians, we want to make sure that we are having a system that not only is sustainable fiscally, but also that does address the care gaps and that no individual should go without their medicines. But we need to make sure that we design a system that is about the patient, that has a solution, and not just walk back on any national pharmacare program. But there are a number of considerations that we need to incorporate into our thinking. And as you know, Dr. Hoskins is chairing the Advisory Council for implementing a national pharmacare program. There's 7 council members that have been announced, and there's roundtables that will comprise a majority of the summer months, the consultation period, to hear from various stakeholders. So I think the process is going to provide for lots of input. We know Ontario, as well as the other provinces, all have various opinions on and different systems that have various coverage gaps. So this is definitely going to be a dialogue that will continue with the provinces, the federal government. We're certainly advocating for a fill the gaps system and maintaining the public-private mix. But with that, having a solution that's centered around those that can't afford their medications, the high complex patients, high cost drugs, around a national catastrophic drug program, and also having some form of a minimum standard formulary so that there is that equitable access across all of the provinces. So we'll engage.
You'd be looking for a national formulary instead of province by province?
Yeah, so it wouldn't be a full national common formulary, but more of a standard minimum. And then each province can still make their own formulary decisions, but that will create an equitable foundation across the country. I think the time has passed to ignore national pharmacare. The debate is around really, should it be a universal first payer system, or should we have a system that respects the provinces and their jurisdiction, but also helps contribute to some of the care gaps that exist? Because really it should be about enhancing care and not just about drug cost. And that's where our emphasis has to be as an industry. We bring a lot of tools, a lot of solutions to the table to drive better care, but we have to get away from the singular conversation around cost and looking at it from the perspective of the care part of pharmacare and what are the solutions that actually can practically be implemented in a fiscal responsible and sustainable manner.
I'm glad you mentioned that. One of the big question marks was the definition of pharmacare, and I've heard multiple definitions, and there doesn't seem to be any consensus as of yet. And maybe this will come out of Dr. Hoskin's task force. But the important point here is that it's not just about coverage. It is about the wraparound services that pharmacists are providing. It's the management of medication therapy, and this is where pharmacists have an incredible value proposition to bring to government, whether it's a federal national pharmacare program or whether it's a provincial program, one that we're going to be looking at very shortly.
We have an opportunity to get this right and to put a new framework in place for all Canadians that does create that equitable access and enhancing care opportunities. So I think it behooves us as an industry to come to the table with solutions and be positive and make it truly about patients. You know, where are those gaps and how do we as an industry play a role, to Allan's point.
So if the profession, the industry, and governments at both levels start from a place that says when a patient needs medication for their well-being, they ought to be able to get it, and that money shouldn't be a barrier, then it's just details. As you mentioned, government is first payer, last payer. Is the drug plan cover 80%, 100%? Who covers the rest? Gap coverage. Yeah.
Gap coverage. I think the other question or the other issue that we all need to keep in mind is one of system sustainability and program sustainability. It's got to be something that we can maintain in the long term, so that not only are we providing the care for ourselves and for our children, but it's for generations to come. It's something that we don't have to rebuild in another 10 years.
Okay, great. Thank you both. James, do we have another caller on the line, or?
Yes, thank you, gentlemen. We actually have another email question here. It reads, do you think the new government will be approachable?
It would be absolutely yes. I think that is the answer right now. Quite simply, we are still in the very early stages. The Executive Council just got sworn in on the 29th, and here we are on the 5th of July. I think it is the 5th, and we are now just starting to re-engage with government. There has been, as with every transition, there's always a blackout period, and we're now past that. And so now comes the fun part where we actually get to sit down and start dialoguing, and we're very optimistic. So I think they will be open. It's every indication up until this point has been saying just that.
A lot of the work we did pre-election on the Pharmacist Care platform with OPA and Neighbourhood pharmacies, I think sets the stage for a collaborative environment and a positive, patient-focused approach. And we are certainly going to be collectively partners for government to align with those policy objectives so that we can see advanced scope, we can see some of the growth potential and better patient care in the neighbourhoods across the province. So this is the time to solidify those relationships and really position the value proposition we have as industry experts and bring that that intellectual bandwidth to the government and look at where do we create that capacity, ending the hallway medicine and really be positioned as a solution to drive towards better efficiencies in the system, as well as certainly care opportunities. The high accessibility of pharmacies and our ability to manage patients' conditions with that trusted relationship is the part of what we have as our value proposition. And we have to do, out of the gates, be very proactive. But I also don't want to say that everything's going to be roses. I think we have to be realistic that this is a government that promised efficiencies of 6% across the board. And it's going to be incumbent on us to look at that in a proactive way so that we're part of that solution and not in a reactive position where we're going to get blindsided by reductions and things of that nature. So a lot of that groundwork has already been done with the Pharmacist Care platform and our 4-point plan, but there's going to be more work to demonstrate the value that they're getting today so that we don't face a similar situation of reductions.
Sure, and approachable doesn't always mean the answer will be yes.
Yes.
Correct.
But all you can ask for is a fair hearing to be able to put your policies and positions forward. I would add to what these gentlemen have said that, you know, this is a premier that more people probably have his cell phone number than any other cell phone number, and he takes great pride in returning calls. You also have a new Minister of Health who, while she was the health critic in the PC caucus, was very accessible. Now, understanding that the demands on the time of the Minister of Health are greater than the demands on the health critic's time, she was always really accessible to stakeholders. Remember, too, this is someone that served as our patient ombudsman in Ontario and has had to deal with patients and families coming forward to talk about their challenges with the healthcare system. And I should add, too, that as you both know, as well as the Minister of Health being in place, that Dr. Ruben Devlin continues to be an advisor to the government on healthcare. So Ruben was a surgeon and the CEO of the Humber River Hospital. Two things that he emphasizes is, one, he's big on customer service, and pharmacists and pharmacies know all about that. And he's looking for innovation, certainly Humber being Canada's first fully digital hospital.
Yeah.
He is looking for people to come forward with innovative, patient-facing, customer service-focused solutions, and I think that bodes well for the profession and the industry.
And we said exactly that with our pharmacy platform. It was about collaboration. It was about building partnerships, a true partnership between the profession and government. And like Justin said, and yourself, Joe, it doesn't always mean things are going to be roses moving forward. But if we maintain that patient focus, maintain the efficiencies that pharmacy can bring to the health system, and that innovative approach to smoothing out that patient experience, I think it would come logically that the provider experience would also likely come hand in hand with that. So we're, again, very optimistic.
All right, James, we have someone with a question on the line.
Yeah, thank you, gentlemen. Coming up, we have a question from Susie regarding government reimbursement for pharmacy investment. Susie, you're now live on the line. Please go ahead.
Thank you, and thank you to everybody on the panel for everything you do on behalf of the profession of pharmacy. My question is, now that we have, the possibility of OHIP plus and redoing it properly, so there would be savings in the government funding of medications. Is there a way that we can make sure that the savings that would happen through the government, that it stays in pharmacy, and perhaps we could make it so that we would then be paid for our expanded scope of practice, and a lot of the services that we're actually doing without actually getting paid for, or perhaps not getting paid a reasonable going rate?
Justin, want to
That's a great question. Thank you for that. And I would say, yes, there's been a history of our recommendations to government to reinvest the savings from other parts of the pharmacy budget. For example, generic price compression and the deflationary pressures that have been applied to pharmacy over the course of the last several years. We've certainly been working with the ministry as well as government to look at mechanisms to reinvest that directly into frontline healthcare. And I think we'll continue with that approach, because that's where the investments in healthcare, when you look at the 50 cents of every dollar going to healthcare, the return on that investment is going to be critical. And there's a few partners in the community, including pharmacy, that can really deliver on that ROI. But it's going to take an approach, a new framework around the entire reimbursement model, and having discussions about the current model of product and pricing. So I think that's going to be part of the broader table that we establish, so that we have opportunities to grow and provide innovation and work with government. So I certainly expect that we'll have those discussions in the coming weeks and months.
Susie, thank you again for your question. Thank you for your very kind comments at its outset. I think over the past 15 years, it's safe to say that we've been living with government policies, legislation, regulation that have been very much ad hoc at best. And I say that from a perspective that we typically would see perhaps reductions in pharmacy funding that were not appropriately balanced and that didn't come with any significant or any offset to help us remain sustainable in the provision of service. And so I look at an example like MedCheck, and we know that the MedCheck needs a bit of a facelift again, and that's currently underway. But I think it's a very logical request coming from OPA and from neighborhood pharmacies to bring these types of ideas that if there is ever any need for if there is any need to reduce funding, that it be offset, and that investments are made back into the profession so that we can remain sustainable in the provision of care, and quite simply it maintains that collaborative approach that that we will still be at the table and still maintained in somewhat of a whole fashion.
And just to add to that, it's going to have to be about patients. So it's not about us, it's not about the business, it's really going to be about what is going to enhance patient care, both timeliness and health outcomes. And that's where we're starting to see more and more momentum in Ontario and elsewhere around this idea of quality, measuring quality, return on investment, and I think we're going to see more scrutiny on that in the coming months and years. So we need to be part of that and figure that piece out and really position it as these are for investments in patient care that accrue benefits not only in pharmacy, but of course across the healthcare system. And that's got to be that will be the success of the platform that we've developed. It is about patients. There's an evidence-based approach to it, and that's where we're going to certainly be successful in our advocacy efforts.
Okay, great. Thank you. Thank you, Susie, for the call. James, can we move on to our next caller?
Yes, thank you, Susie. Coming up next, we have a question from Dave regarding the co-pay plan. Dave, you're now live on the line. Please go ahead.
Hey there, and thanks so much for organizing the call and gents for your insight and advocacy on behalf of the industry. Just wondering what you think might happen with respect to the copay promise that the Liberals had in their budget now that we've got a new provincial government with Doug Ford and the PCs.
So let me take a stab at this, and then I'll turn over to Justin and to Joe for their commentary. But it's actually more than a promise now, because that was part of the budget bill, and Joe, correct me if I'm wrong, but that was part of the budget bill that was passed at literally at the 11th hour, just before the writ was dropped for the election. And so that technically, that Liberal promise to remove the copays and deductibles is technically law of the land and set for implementation. Unless something changes, it's set for implementation in August of 2019. What that implementation is going to look like, we don't know yet. Nothing has been done in that regard. There's been no discussion as of yet. As I mentioned earlier, only just now has government reopened their phone line, so to speak, to engage with stakeholders. So these are going to be parts of the discussions that we will bring in terms of what is the plan. But right now, still a little bit of a question mark.
Yeah, I can't disagree with anything you've said. I would only say that there is risk, given what we've seen with the OHIP Plus announcement. The question that they're going to be asking is this the investment that we want to make? Is this the right investment we want to make? I think from our perspective, we need to make sure that whatever decision is made, that money is directed into pharmacy and into patients, and whether that's through continuation of the policy and the bill that was passed, or if it's some other mechanism, we want to make sure that it stays within patient care and in the community. But it remains to be seen where they'll land on that in this particular time frame that we're in. We're still very early.
I would only add from a kind of a legislative perspective, Allan is right. That measure was included in the 2018 provincial budget that was tabled and passed by the Liberals on the very last day of the legislature before the election started. Having said that, it is now law, but the new government does have the ability and the authority to either repeal that budget completely or amend it through the legislative process. So we are hopeful, and Justin, you spoke to the investment. I think they had costed it out at the time of $575 million. So the question to be contemplated by the new government is, do we want to spend $575 million on that, or redeploy that money to somewhere else, or reduce spending? Because this is a government that, while they've acknowledged they're not going to balance their budget in the first year or second year, that they want to by year 4. So there may be some difficult choices ahead for them, but the question is a good one. Thank you, Dave, for that. James, do we have anyone else on the line?
Yeah, well, thanks, Dave. We actually have another question that was submitted through email. It reads, as a pharmacist, what can I do to help lobby for some of these issues?
Oh my goodness, that's a great question, and I'm glad you asked that. There's actually quite a lot that we believe, certainly from an OPA perspective, that you as a pharmacist can do. First of all, it's practicing the way you believe and we believe pharmacy care ought to be practiced. In other words, as Justin has alluded to, it's got to be about the patients. We've got to make sure that we are living and breathing the words that we are advocating, and that is providing solid patient care. And that, notwithstanding the challenges, we're doing our very best for patients. At the end of the day, what can happen with that is that you are sending a message through your patient that you are a very much valued healthcare provider, that you are an integral part of their circle of care. They themselves, the patients, can be one of the strongest advocates for pharmacy. But that said, getting more specific, you have as just like myself and Justin and Joe, we all are citizens of this province. We all have MPPs that represent our specific interests in our constituencies, and you have the ability to knock on their door and pick up a phone and to contact them and to let them know exactly what it is you can do for your patients.
Or go meet them.
Or go meet them. There really is. There are several opportunities, whether it's letter writing, sending an email to either the constituency office or to their office at Queen's Park, as Joe said, meeting with them. Probably the loudest voice that we as organizations have are our respective members, and bringing that voice, and makes it much more personal, much more, and it takes it home for the member of provincial parliament. They will hear firsthand what it is you're doing, inviting them to your pharmacy, and having them observe and see what it is you're doing on a day-by-day basis. It sounds trite, but it's exceptionally powerful.
Yeah, I mean, hard to disagree with anything you just said. I think absolutely the patient, the grassroots is where the power in numbers is, and support. And traditionally we haven't done the best job in engaging, and we did more so this last couple of years, and you can see that people are more aware of the services that pharmacists provide and more supportive of. Because when you have a service and you deliver it in a quality fashion, the patients want more of that service, and they become your greatest advocates. So to your point, engaging patients, enabling them to be the voice, and to really talk about the value that they have in the relationship with the pharmacist. Because anything that you have and then it gets taken away, you will have support and an outcry about that. So as a healthcare provider, we need to position ourselves in that positive light. And of course, engaging directly with our health officials in the ministry, as well as politically. So
I'd also add that the Ontario Pharmacist Care website is still available and still accessible, and it provides opportunities to find out more about our particular issues, and provides some of that background information that you can use in your meetings, in your letters, in your calls with an MPP.
If I could add, I love that question, because as a government relations practitioner, we often ask, how can we get pharmacists and real people out there more engaged and more involved in the lobbying efforts? So I would say to pharmacists, there's a brand new government, and historically in Canada, in provincial and federal elections, the turnover, the number of new people elected, has been about 30%. It's average 30%. This election was very much a change election. We have 60% of the
That's
124 MPPs are first-time MPPs. That means that when it's flu season, for example, that MPP may not know that they can go to their local pharmacy. And as many of the group who just finished their term, lots of them would go to their local pharmacy and they take a picture and it would be in the local paper. It's all good, right? Good for the pharmacy, good policy, good politics. The new people may not know. So I would say to pharmacists, because of the number of people who are elected for the first time, you might need to retrace your steps a little bit, just like the two associations who have been to Queen's Park all the time, many times on your behalf, are now going to have to retrace their steps because we have a new everything. We have a new premier, a new minister of finance, a new minister of health. So what the associations will be doing at Queen's Park, we need pharmacists locally to do in the communities. And I like the numbers: 4,000 pharmacies, 124 ridings. That's pretty good. There really should be no riding that doesn't hear from or meet with, be it a phone call, a meeting, an email, from a local pharmacist that can talk about some of these important issues. So I love that question. Thank you very much for the question.
And it's really the power of the story. Telling the story about the patient, the journey, and how you help that patient will go a long way to resonating with decision makers, and we need to tell more stories. Pharmacists are heroes in the community to a lot of patients, and we don't tell enough of those stories.
Okay, great. Thank you for that. James, do we have another question?
Yes, thank you, gentlemen. Coming up next, we have a question from Anne regarding the opioid crisis. Anne, you're now live on the line. Can you please go ahead?
Hi, I am just wondering what each organization is doing to combat the opioid crisis, and if there's something that government could or should be doing.
Thank you for the question, and we have worked collaboratively on a pain management program that focuses really on the three aspects of the crisis. One is on the prevention side, harm reduction, and education. And I think there's a lot more that pharmacists could be doing to help contribute a solution to the growing crisis. Quite frankly, it's unacceptable, the human toll that's being taken in Ontario and elsewhere, and it's not getting better. We know there's more deaths last year than any other period. We have worked with the previous government, and we continue to work with the ministry to launch a pilot for this pain management program that will really focus on changing dosages with some changes of the federal regulations to permit pharmacists to do more, but also to look at secondary and tertiary treatment options. So for acute patients, acute pain, we'll have a module. We've put in clinical protocols using McMaster guidelines and HQO. And we have a chronic pain module. And the pilot that we are working on will also have a research design and metrics that will evaluate the success of the program over a 6 to 12 month period. So we're very encouraged and optimistic that we'll be able to launch this demonstration project. The reality in Ontario is that there's 5 new patients every day that become dependent on an opioid. That's a staggering number because over a 5-year period, it fills BMO Field of over 35,000 people. So pharmacists are frontline healthcare providers that can work on prevention. And I think also with our pain management program and the expertise of pharmacists, we can offer medicinal cannabis as an alternative where there's no known overdose deaths. And with the indications and the known evidence base that is growing every day, we know that for pain, medicinal cannabis is very effective.
This program that we are proposing and this pilot that we're proposing with government is exceptionally exciting. We've been engaged in this joint effort going back. It's almost a year now, and we've had some very positive receptivity within the ministry. Many of the individuals within the ministry are still there, and so we're not necessarily starting right from scratch. Certainly, we will be wanting to have a discussion with the new Minister of Health, but we believe that we've made some great strides in this area. The other area, and if I can just add to one of Justin's comments, this approach that we are proposing is one that is much more preventative, much more proactive, as opposed to the reactive role that we've been put into. Not that it's unimportant, but the role of distribution of take-home naloxone, again, while it is a life-saving treatment for many who are going through the challenges of opioid addiction and overdose, that is very much a reactive approach, and we believe we have so much more as medication experts. We see these patients every single day, trying to manage and struggling with chronic pain, and we believe we have much more to offer than just the distribution of naloxone. The last thing I would add is we're not sure yet where the government, where the Progressive Conservative government sits with the opioid task force, the emergency task force. We do have pharmacy representation on that task force, but it remains to be seen as to whether the government wants to take a slightly different approach. We've heard that there is intent to keep the task force, but it's right now sitting in a hiatus mode. Hopefully we'll hear soon that this will be re-engaged.
That's great. My only contribution would be that a lot of the media focus on this problem is about prescribing patterns, is about advertising by manufacturers, and it seems to me, since pharmacists, since your people, they're the last hands that these things pass through before they go into the community. Pharmacists are like the goalie on the opioid problem. So it kind of makes sense to me intuitively that governments and public health agencies, those that are concerned about getting this problem under control, should talk to pharmacists, to pharmacies, should look at your proposal quite seriously, because look, it's great that you give out naloxone, but it's not enough. I mean, the numbers that you just referenced, Justin, are staggering still.
Yeah, staggering.
That's still happening is a little bit mind-boggling to me. As a layman and as a citizen, I certainly want to see something done about it. Well, gentlemen, this has been great. We are unfortunately running out of time. We want to thank all of the people who called or who sent in questions by email. This was intended to be interactive, and you certainly made it so. Want to thank Justin from the Neighbourhood Pharmacy Association of Canada, Allan from the Ontario Pharmacists Association. So this will be archived.
Yes, it will.
Anyone that wasn't able to watch it live today will be able to see it. Again, as you mentioned, the OntarioPharmacistCare.ca website is still active and live, and we encourage you to participate through there. And I guess finally, direct contact to either one of you gentlemen or both of you from pharmacists out there that want to talk about these and other issues. You've always been very open and accessible to people who want to talk about things, so that is also another option for you that are a pharmacist or someone who cares strongly about these issues. I know that you're both optimistic about working with the new government and with each other. Okay. And we look forward to going down that road together and working. It looks like we're going to have to work over the summer, though, but that's what happens with the June election. So thank you, everyone, for joining us, either live or if you're watching this in archive mode. We do appreciate it. We are open to your feedback, and we thank you very much for joining us today.